If you're involved in the fitness world, chances are you've heard of creatine. It's a popular supplement that many athletes and bodybuilders swear by for enhancing their performance and muscle gains. But have you ever wondered what actually happens to your body when you take creatine? To understand the effects of creatine, we first need to understand what it is and how it works. Creatine is a naturally occurring compound found in small amounts in animal protein. It's also produced by our bodies, mainly in the liver, kidneys, and pancreas. Creatine plays a crucial role in the production of adenosine triphosphate, or ATP, which is the main source of energy for our cells. When we consume creatine or take it as a supplement, it gets stored in our muscles as phosphocreatine. Phosphocreatine then helps regenerate ATP during high-intensity activities, such as weightlifting or sprinting. By increasing the available phosphocreatine in our muscles, creatine supplementation can enhance ATP production and improve performance in short-duration, high-intensity activities. In addition to its role in ATP production, creatine also has the ability to increase muscle cell volume. When you consume creatine, it draws water into your muscles, causing them to swell and appear larger. This can give you a fuller, more muscular look. The increase in muscle cell volume can also have an anabolic effect by stimulating protein synthesis. This means that your muscles have a greater capacity to build new proteins, leading to muscle growth over time. Another benefit of creatine supplementation is its ability to reduce muscle damage and inflammation. When you engage in intense exercise, your muscles undergo microtears and experience inflammation as a natural response to repair and strengthen themselves. However, creatine has been shown to have anti-inflammatory properties, which can help reduce muscle damage and inflammation. This means faster recovery, less soreness, and improved overall training performance. It's important to note that creatine is not a magic pill that will instantly transform your physique. It's a supplement that works in conjunction with proper nutrition and training. To maximize its benefits, it's recommended to consume an adequate amount of protein and carbohydrates throughout the day. Additionally, creatine supplementation may not be beneficial for everyone. Some individuals may not respond as well to creatine, while others may experience digestive issues or water retention. It's always advisable to consult with a healthcare professional before starting any new supplement regimen. Lastly, it's worth mentioning that creatine is one of the most researched supplements on the market, and it has been shown to be safe and effective when used as directed. However, like any supplement, it's important to follow the recommended dosage and not exceed it. In conclusion, taking creatine can have several positive effects on your body. It can enhance ATP production, increase muscle cell volume, improve recovery, and potentially promote muscle growth. However, it's essential to approach creatine supplementation as part of an overall training and nutrition plan. As always, listen to your body, pay attention to any side effects, and consult with a healthcare professional. With the right approach and proper use, creatine can be a valuable tool in reaching your fitness goals. Now that we've covered the basics of creatine and its effects on the body, let's dive deeper into some additional aspects that are often discussed in relation to this popular supplement. One area of interest is the potential impact of creatine on cognitive function. While the primary role of creatine is in the energy production of muscles, there is some evidence to suggest that it may also have cognitive benefits. Research has shown that creatine supplementation may improve short-term memory and cognitive performance in certain populations, such as vegetarians and older adults. However, it's important to note that the effects of creatine on cognitive function are still being explored, and more research is needed to fully understand this relationship. It's also worth mentioning that individual responses can vary, and not everyone may experience cognitive benefits from creatine supplementation. Another topic of discussion when it comes to creatine is its potential for causing dehydration or muscle cramps. While some individuals may report experiencing muscle cramps or increased thirst when taking creatine, these effects are not consistently observed in scientific studies. In fact, studies have shown that creatine supplementation does not significantly affect markers of hydration status, such as body weight or urine-specific gravity. Moreover, maintaining proper hydration by drinking enough fluids is always important, regardless of whether you're taking creatine or any other supplement. It's also worth mentioning that creatine supplementation has been extensively studied in various populations, including athletes, older adults, and individuals with certain medical conditions. Research has consistently shown that creatine is safe for short and long-term use when taken as directed, with no significant adverse effects. However, it's important to be aware that some individuals may experience gastrointestinal side effects, such as stomach cramps, bloating, or diarrhea, when taking higher doses of creatine. These side effects can often be minimized by starting with a lower dose and gradually increasing it over time. Additionally, individuals with pre-existing medical conditions, such as kidney or liver disease, should exercise caution when considering creatine supplementation and consult with their healthcare provider. So, who can benefit from creatine supplementation? While the majority of research and evidence has focused on athletes and individuals involved in high-intensity training, creatine may also have potential benefits for other populations. For example, older adults may benefit from creatine supplementation, as it has been shown to help preserve muscle mass and strength, improve exercise performance, and enhance functional capacity. Additionally, individuals with certain medical conditions, such as muscular dystrophy and chronic obstructive pulmonary disease, COPD, may experience improvements in muscle strength and functional outcomes with creatine supplementation. It's important to emphasize that creatine supplementation should always be approached as a complement to a well-rounded training and nutrition program. While creatine can offer potential benefits, it's not a substitute for hard work, proper training, and a balanced diet. It's also important to consider the quality and purity of the creatine supplement you choose. Look for reputable brands that undergo testing for purity and quality control. This will help ensure that you're getting a product that meets the highest standards. Additionally, when it comes to dosage, the most common approach is to follow a loading phase followed by a maintenance phase. During the loading phase, a higher dosage of creatine is taken for a short period, usually around 57 days, to saturate the muscles with creatine. This is typically followed by a maintenance phase, where a lower dosage is taken to maintain the elevated levels of creatine in the muscles. Recommended dosages can vary depending on factors such as body weight, muscle mass, and individual goals. It's always advisable to follow the instructions on the product packaging or consult with a healthcare professional to determine the appropriate dosage for you. Finally, it's important to remember that creatine is just one piece of the puzzle when it comes to optimizing your fitness and performance. Consistency in training, proper nutrition, adequate rest and recovery, and overall good lifestyle habits are crucial factors that contribute to your overall well-being and athletic performance. So, whether you're an athlete looking to enhance your performance or someone simply looking to support their fitness goals, creatine can be a valuable supplement in your arsenal. Just make sure to approach it with a well-informed mindset, research the best practices, and consult with professionals when needed. With proper guidance and a comprehensive approach to your training and nutrition, creatine can be a powerful tool to help you reach your fitness goals and unlock your full potential. As the world of sports science continues to evolve, new research and insights into the effects of creatine may emerge. So, stay informed, stay curious, and continue to pursue knowledge as you navigate the exciting world of fitness and supplementation. And remember, while creatine can offer benefits, it's important to approach any supplement with an understanding that individual experiences can vary. What works for one person may not work for another, so it's always a matter of personal experimentation and finding what works best for you. With that being said, we hope this video has shed some light on what happens to your body when you take creatine. As always, we encourage you to do your own research, consult with professionals, and make informed decisions when it comes to your health and fitness journey.